Hello, and congratulations on your sweet baby. I'm Lori Cochran.
And I'm Tanya Klein. We're speech-language pathologists on the Cleft and craniofacial team at Cook Children's Medical Center.
We help with feeding, speech, language, and voice treatments for children with cleft lip and palate throughout their childhood. You may be watching this video because you were told your baby has a cleft lip and/or a cleft palate.
We know this can be a scary time and you may have lots of questions. Our team is here to help you.
You may have already met with the surgeon for a prenatal visit and learned about surgeries and other treatments that your baby may need as he or she grows.
In this video, we'll talk about some things you need to know about your baby. The healthcare providers in your birth hospital may know a lot about cleft lip and palate, or they may not. We want you to know the most about what your baby needs.
Let's talk about the first few hours after your baby is born.
You can hold your baby skin to skin. You can also put him or her to breast if breastfeeding is your goal.
If he or she is healthy and breathing well, they will stay in the room with you. A cleft lip or palate will not change that.
Now let's talk about feeding. First, we'll talk about feeding a baby with cleft lip only. Then we'll talk about feeding a baby who has a cleft palate.
If your baby only has a cleft lip, you can breastfeed or bottle feed.
If you're breastfeeding, you can try common holds like the cross cradle hold or the football hold. Babies learning to breastfeed may need some help latching from a lactation consultant or a speech therapist.
If you're bottle feeding, you can use a bottle from home or the bottles at the hospital. Hold your baby cradled in your arms.
If your baby's cleft lip goes into the gum line, latching onto a bottle or breast can be tricky. Be sure to reach out to our office or your lactation consultant for help. In order to get milk out of a breast or a bottle, babies do two things: suck and compress, which is a biting or munching movement.
Babies with cleft palate have a sucking reflex but are not able to suck because of the hole in their palate. It's like a vacuum cleaner with a hole in the hose. Instead, babies with a cleft palate can only use compression or the munching movement to get their milk out.
This means babies with cleft palate are not able to breastfeed for nutrition. You can still put your baby to breast for comfort and bonding. This is called non-nutritive breastfeeding. However, you will still need to pump and give them breast milk by bottle.
We recommend the Dr. Brown's specialty bottle. It's specially designed for babies with cleft palate. The bottle looks the same as the Dr. Brown's Options bottle, but it has a blue valve that goes up into the nipple. This valve causes the bottle to work by compression instead of suction. Try using a level 1 nipple first.
You will hold your baby completely upright in your lap like he or she is sitting up. Hold their neck and shoulders with your hands like this.
It's okay if milk gets into your baby's nose while they're eating. That's expected because of the hole in the palate. It can be uncomfortable, so feeding in this upright position can help.
Give your baby breaks during feeding. When they sound like their nose is congested, burp them, and then give them a pacifier for a minute to help them move the milk down.
The man pacifier works well for babies with cleft palate because of the shape. You will have to hold it in their mouth since they can't suck.
We recommend only using the pacifier during feeding and not for comfort. Your surgeon will want to avoid pacifiers after any surgeries, and it may be difficult to stop if your baby has gotten comfortable using it.
Lastly, we want to show you one other position you can feed your baby in. It's called elevated sideline. Use this position if your baby shows signs that the milk is coming out too fast for them.
Those signs might be pulling away from the bottle, coughing, lots of milk leaking from their mouth, wide eyes, or if they seem stressed in any way.
Lay your baby on his or her side on a pillow with their head a little higher. Put their bottom against your belly and their hip, shoulder, and ear in a line, all pointing up to the ceiling.
Elevated side lying helps your baby breathe and swallow at the same time more easily. It slows down the flow of the milk and gives them more control when they're eating.
You will see one of our speech-language pathologists for a feeding evaluation within 1 to 2 weeks of delivery. At that appointment, the therapist will watch your baby eat and make changes to the bottle or nipple if needed. You should go to the hospital with 2 bottles, but you might want to wait to buy more until after this appointment.
The goal is to make sure your baby is eating easily and quickly enough to grow well. If your baby's having trouble with eating at any time, please reach out to our Cleft Lip and Palate team. We are here to help.